A good afternoon, everyone. A warm welcome to you all. I'm really delighted to welcome you for this webinar on mental health, the best practices. So this has been organized during the European Mental Health Awareness Week. And actually, this webinar builds upon a series of events organized previously. One of the main ones was the one in March 23, which was organized by the MEP Interest Group on Integrative Medicine and Health. It was hosted by them, called Integrative Medicine, Mental Health, The Way Forward. So I will be your chair of today. I will start with a brief introduction of myself. So my name is Adrianne Waldt. I serve on the executive committee of EUROCAM, and I also coordinate the MEP working group. As an acupuncturist practicing in a conventional hospital in Belgium, I'm also actively involved with both the national and the European traditional Chinese medicine associations, ETCMA. So in addition to my clinical work, I also have contributed to clinical research and delivered guest lectures. And actually with my background in international relations, my mission is really to inform both the medical community as policymakers about the evidence-based strategies and therapies and to advocate for their integration to improve patient care. So also briefly about EUROCAM. EUROCAM is a European foundation that actually brings together umbrella organizations, both for patients, physicians, practitioners, veterinarians, all active in the field of traditional complementary and integrative healthcare. EUROCAM plays actually a central role in advancing the integrative health policies. We are also accredited as a non-state actor to the WHO, Regional Office of Europe. And actually both the European Commission as the European Parliament acknowledges us as the organization representing our community of healthcare professionals and patients in the sector. The different modalities, they vary from acupuncture to Ayurveda, anthroposophic medicine, herbal medicine, homeopathic medicine, traditional European medicine, Reiki therapy, and traditional Chinese medicine. Here we always base ourselves on the clinical expertise and the best available clinical evidence from the scientific research that is built over the last few decades already. So these series of webinars are also now in partnership with Charité University Hospital. We were really happy to have this cooperation with this academic prominent center. So yes, let me maybe also thank the Health Policy Platform for hosting the event. We're very grateful for that. And also, of course, the many participants, because there were a lot of registrations, and so we're very happy to see that. I would also welcome all our speakers. We have a wonderful panel. And let me introduce shortly what we'll be doing this afternoon. So we will start actually with an intervention of the MEP Aurelius Verriga. I will shortly introduce him to you as well, after which we will have a panel discussion. And the beautiful thing about this panel discussion is that we will have insights actually from various perspectives, because we will bring not only like the academic view, but also the clinical practices, like how it's being organized already in various European countries. And we are also very much delighted to also have a patient's and the patient's family's voice here today. So the last thing I would like to mention is that this webinar is actually under also the umbrella of our new strategic initiative, which called Refocusing Health. This started in September last year and is until December 26. It's an initiative that has been made possible by the Triodos Foundation, for which we are very grateful, obviously. And the aim here is actually really to promote the role of TCIH, so traditional complementary and integrative healthcare, in advancing the One Health principle. So this One Health principle recognizes obviously the interconnectedness of animal, human, and environmental health. So I think we will be touching upon this also later on in this webinar. But let me actually just start with introducing our honorable guest, member of the European Parliament, Aurelius Veriga. So Mr. Veriga, he is a Lithuanian politician and currently member of the European Parliament, representing the European Conservatives and Reformist Group. He served as a Lithuanian Minister of Health from 2016 to 2020, and he has also extensive experience in public health policy. Beyond his parliamentary work, Mr. Veriga also contributes to the global health initiatives as a member of the Advisory Council of Innovation for Non-Communicable Diseases at the WHO Regional Office for Europe. He also leads the Lithuanian Farmers and Greens Union as its chairman since this year. Let me ask to put on the video that he delivered for us.
I stopped because you were saying that there was an issue with the video, that's why.
Then maybe let me just continue, and as soon as it's back up, we can maybe listen to the second part, because he has some really nice issues that he's raising to highlight also the political importance of this integration in the public health sector. So yes, let me start with the panel discussion then. So this panel discussion will look at how traditional complementary and integrative healthcare could support better mental health in Europe. So for this, I would like to start with bringing the view of the academics forward. So for that, we have Dr. Hiba Boujnah. She's a public health expert specializing in health policy and diplomacy, and currently working on the integration of traditional medicine into modern healthcare systems. She's the head of the international cooperation and partnerships at the Charité Competence Center on Traditional and Integrative Medicine in Berlin. And she has held also key roles in international organizations such as the WHO and the African Union. So Dr. Boujnah is passionate about equitable healthcare access and also the decolonization of health systems by incorporating indigenous knowledge. So welcome, Hiba, nice to have you with us. You're also one of our partners. So please, could you maybe dive into what the difference is between integrative mental health and actually the current conventional mental health system?
Thank you very much, Adrianne, for the nice introduction, and hi everyone from wherever you are logging in to share with us this hour and a half. We are very grateful to have you here. Thank you, Adrianne, and thanks also to our MEP who really set the stage for the importance of integrative mental health care from the policy side of things. I hope we can watch the rest of the video. You got me very excited about it, Adrianne. So yeah, basically, before I address your question, Adrianne, I'd like to quickly echo the perspective from which we are looking at things today. And to do that, I'd like to go back to the EUROCAM new initiative, refocusing health, and really insist that this is a timely and much needed call to reframe health through the One Health lens, which acknowledges the deep interconnectedness between human, environmental, and animal well-being. We at Charité and at our center, which is Charité Competence Center for Traditional and Integrative Medicine, like to streamline things. We like to look at things from a holistic approach. And we are particularly interested in mental health. And therefore, when we look at mental health, we look at it from an integrative standpoint. So actually, we have done some studies recently that really touch on the mental health aspect of things, where we looked at the impact of green spaces and on patients who have confirmed diagnosis of mental health disorders. So we recently conducted the WHO commissioned systematic review and meta-analysis that evaluated, as I said, the effects of green spaces interventions, such as forest walks, therapeutic gardening, and nature-based therapies on individuals with diagnosed mental disorders. The analysis that we conducted covered 17 randomized clinical trials with nearly 950 patients. And the results were very, very interesting. They showed clear improvement in depressive symptoms and notable boost in positive emotional states among these patients when they engaged in nature-based therapies. Particularly, this was true particularly for individuals with schizophrenia, where green space interventions significantly improved positive and negative effect and reduced general psychopathology scores. So these are not marginal effects. What we're trying to say here is that these effects point to the therapeutic power that nature holds, especially in the context where we know that mental health services are under-resourced. Mental health services are not available everywhere. They really vary from country to country, and even within the country, they vary from region to region. And we have seen that when we have global crises such as the pandemic, it really exacerbated this deep need for mental health support. Therefore, we do believe that green space interventions are not only accessible, they are low cost and they can be scaled at a community level. And therefore, their benefits extend beyond treatment to cover prevention and recovery support. In fact, when nature exposure is combined with mindful practices such as slow walking or breath awareness, it can further reduce stress and improve emotional regulation. And that is particularly true in young people who might not have access or the means to access the traditional mental health support. Yeah. This type of community-centered integrative activities are really crucial in tackling today's mental health crisis. And sort of like responding to your question, Adrianne, what is the value of integrative mental health? Why is it important? So these findings that I spoke about speak to something deeper, which is the need for an integrative approach to mental health, one that sees individual as a whole, complex being, and sees healing on as a multi-layered process. So in addition to what I said, across a wide body of research, we've been seeing that approaches such as mindful yoga, relaxation techniques, meditation can really reduce anxiety, alleviate depressive symptoms, and support emotional balance that is very much needed to have a healthy body with a healthy immune system. So these methods can complement conventional care and enhance outcomes, especially when it comes to personalized patient needs. Things like acupuncture, herbal medicine, usually used in traditional Chinese medicine, have also showed promising results in managing anxiety and depression, often with fewer side effects than the standard treatments, because we are all aware that the medication can have side effects that could vary from a patient to the other. In some cases, combining conventional medication with these holistic approaches can lead to stronger effects. Also, practices like energy therapies like Reiki are showing early signs of benefit in clinical populations, not just improving mood, but also in some cases reducing physiological stress markers such as blood pressure and heart rate variability. So what is really powerful about integrative approaches is that they don't replace conventional treatments. Wherever the conventional treatment is indicated, it remains. They expand the range of tools available, often offering low-cost, culturally rooted, and patient-empowering options. And this is very much true today, and I piggyback on what our MEP said. We are facing a time where mental health demand is rising and many systems are overstretched. These options and combining these options can be a vital complement. Ultimately, integrating these approaches all together doesn't just improve care, it reshapes the way we see mental health into one that is more humane, more holistic, and more aligned with the way we actually live. Mental health is not separate from the well-being in general of individuals. It's not only the problem of those who are clinically diagnosed with mental health disorders, it's everyone's business. We all need our mental health to be supported as part of a holistic approach to well-being. And I saw a question in the chat, looking at the screen, asking for the reference to the study we conducted. It's actually under review. I decided to share some of the insights in this webinar because we work with EUROCAM closely. And I was okay sharing some of this here, but we can definitely share with you all the study once it's out. It's being under review in one of the journals. And thank you very much. I pass it on to Adrianne.
Wonderful. Thank you so much, Hiba, for putting more like the academic scene and giving actually more an insight of the difference to the conventional mental health system. Thank you so much. Okay, so then we will actually move forward to a clinical approach. So for that, I would like to introduce to you Professor Dr. Gustav Dobos. So he's a professor of Complementary and Integrative Medicine and also founding director of the Department of Complementary and Integrative Medicine at Essen Mitte Clinic in Germany, amongst also other chairing positions that he holds. So he's a trained internist specializing in nephrology and intensive care medicine. One of his major scientific focuses is actually mind-body medicine, and he's regarded as a leading figure in Europe, and he's authored also about 10 books, including 300 Medline listed publications, of which 50 are really focused also on mental health. So yes, for the last 22 years, he had led the Department of Complementary and Integrative Medicine and as its director, where fairly chronically ill patients were treated successfully since 1999. So really nice to have you among us, Dr. Dobos. So let me immediately dive into a question to you as well. Why do you believe that mindfulness could offer like an added value for patients? And well, let's start with that.
Thank you very much, Adrianne, for the nice introduction. Mindfulness is a trendy term, but hardly anybody can explain what it is on a daily basis. And I don't believe in mindfulness. It's just science. I mean, if you give in mindfulness into Medline, you find 30,000 hits. That means 30,000 studies on mindfulness-based therapy had been done over the last 20 years. That's a lot. And I can share my personal story with mindfulness and depression, for example. As a head of the Clinic for Complementary and Integrated Medicine, we started 25 years ago to treat patients who were severely sick with mainstream medicine, and beside that with complementary medicine and mind-body medicine. And we had a training in mindfulness-based stress reduction, a couple of relaxation techniques, and tried to integrate it in the clinical setting. We also had an outpatient program, a daycare clinic program. And something very surprising happened when we, after a while, we recognized that the patients we were treating, and these were patients who were chronically sick, either internistically or chronic pain patients, we realized that patients after 7 to 10 days mentioned that they felt much better. They called it a Klick-Phänomen. Auf Deutsch, sie sagten, es hat einen Klick gemacht. I think one can translate it. I found it's a breakthrough moment or a turning point.
Yeah.
And it was it happens on a regular basis. And we realized that these patients who were also depressed beside their regular disease, their official disease, maybe 50 to 70% were depressed because of the physically sickness. But after a short time, they got better, and we did not know why. So we started in our research department to systematically investigate all complementary methods which were published, and we also did over 50 studies on depression and complementary medicine. And we identified 26 different methods, complementary methods, who had, with a positive meta-analysis, who were effective in mental health, especially in depression. So we started to integrate these therapies more into our clinical setting. And since 5 years, we also have a cooperation program with the psychiatrist department and treat severely sick psychiatry patients either with complementary medicine, mind-body medicine, and with mainstream psychological and pharmacological treatment as well. The problem, especially in depression, is that antidepressive drugs do not work very well. It's not a secret. We have a couple of papers on this topic. For example, of Kirsch from 2028, he published a paper where he showed that in mild to moderate depression, antidepressive drugs do not work at all. And they only work if there is a very severe depression. There are, from Munkholm et al., also a study who reanalyzed a positive study of the pharmaceutical company that every drug is working, and he found out that the effect size is very low, so it does not have any effect. The problem with the psychological therapies, with psychotherapies, that there are very long waiting lists.
Yes.
There are waiting lists of 6 months, and so, according to our experience of 25 years and more than 50,000 patients, I would recommend a lifestyle program, a mindfulness-based lifestyle program, integrating either meditation or yoga, and a diet rich in plant-based, whole grain, whole food diet, Mediterranean diet, a non-performance oriented exercise program, so not the marathon run every week, but a walk in the forest. As Hiba told, being in the forest is medicine. It's better medicine for many patients as an antidepressive drugs. And the fourth part is the social support. Take care of your friends, that you're not alone. And that's a very important source for being happy also.
That's also like social prescription is also like a term that comes up more and more, right? In this field. But 50,000 patients, that's quite a number. So I think we could definitely take some best practices out of what already has been done now in the university hospitals and clinic that you work at. Thank you. Thank you so much for this contribution. Yes, very helpful.
Thank you.
Yeah. So let me maybe just go forward to our third speaker of the panel of today. It's Dr. Aram Akopian. So he is actually an expert in traditional medicine for over 35 years. He holds also a degree in computer science and traditional Chinese medicine, but also Western medicine. He's actually my dear colleague because we are at the same board. He's specialized in physical medicine, TCM psychology, and also neuro rehabilitation, where he has practiced both in the US as Greece. So Dr. Akopian actually brought also together his expertise, via which he has developed an AI-driven learning tool for TCM students. And he's also lecturing integrative mental health and TCM neuropsychology. So in addition to his clinical and academic work, Dr. Akopian is a philanthropist who has led health initiatives both in Nepal and Armenia. And so, yes, also a wonderful publication of his is Elemental Nutrition, based on the principles of Chinese medicine. So I think he's very much placed to answer the following question. Dr. Akopian, why do you believe that TCM, traditional Chinese medicine, is an added value for mental health in the EU?
Thank you, Adrianne. I love your accent. I love the way you pronounce Aram. That R is just sweet. I want to thank the EUROCAM and Charité for the opportunity to share our perspective. I represent the ETCMA as the communications director, and the European TCM Association represents over 30 countries and nearly 20,000 healthcare practitioners across Europe. Today, I want to share with you the idea of how does TCM fit into the mental health as part of a collaborative and integrative approach to achieving a better outcomes for our citizens and building a more sustainable, resilient, and responsive health system across the European Union. Now, we've already agreed on the concept that mental health concerns are rising rapidly, not just in scope or scale, but also complexity. And conditions such as depression, anxiety, trauma-related disorders, chronic stress are now among the highest contributors to disability and disease burden. And these challenges don't affect only the individuals, but also communities at large. So the need for an effective, resilient, and inclusive patient-focused or citizen-focused approach is more urgent than ever. Traditional Chinese medicine offers a truly unique approach with personalized, patient-centered model of care, one that recognizes that mental and emotional well-balance is deeply interconnected with the physical health of the patient, the lifestyle, and the environment, and the individual's constitution as well. So it's unlike the classic one-size-fits-all. TCM practitioners look at every individual through a detailed diagnostic lens, methods, and prescribe individualized interventions. And this really presents a unique opportunity because no two individuals with the same Western diagnosis present the same way. For example, anxiety in patient one may be treated with suppressive treatments to treat regulation of emotions, emotional tensions, and addressing digestive pathologies. In another patient that's been diagnosed with anxiety, you may need to approach with a more calming intervention to support sleep, regulate heart rhythm, and emotional stability. So these are all unique elements that highly tailor the approach to ensure that treatment addresses the root cause in a unified fashion, in a whole person fashion. And this prepares the patient to be more involved in their own well-being as well. Interventions such as acupuncture, herbal medicine, which we've talked about, Tai Chi and Qigong, which are meditative movement exercises, have already demonstrated in numerous clinical studies and meta-analyses to be effective in treating mild to moderate depression, anxiety, sleep disturbances, and stress-related disorders. Just as importantly, though, these treatments are safe, non-invasive, non-addictive, and well-tolerated. So this makes them very unique and suitable for long-term and preventive care, right? The same treatments have a much broader implication on the patient, where they can not only address emotional imbalance, mental clarity, mobility issues, cardiovascular functions, immune response, all from a low-cost intervention perspective. Now, from a systemic approach, TCM presents a compelling case for cost efficiency. Compared to like long-term pharmaceutical treatments or hospitalization, these therapies involve fewer side effects, lower long-term risks, and can be delivered in group or community settings. Now, this is very important because these community settings in the rural area, I think my colleague, Dr. Boujnah, talked about the accessibility and availability of participation, right? The wellness centers, community clinics, or even through advanced digital platforms. Reaching out allows lower per citizen participation costs, greater access, and wider participation, particularly in these rural and under-resourced areas where there's a demand for mental health services, which outpaces the available capacity. Right? Now, even more compelling in my perspective, from clinical perspective, is the empowerment that TCM gives to our citizens. Many of these techniques can be learned, can be integrated into their daily activities. And my colleague, Professor Gustav, talked about mindfulness, right? Mindfulness is a lifestyle. It's not a 1 hour practice that you go and do a walk. It's a state of being. And these mindfulness elements allow the customers, allow the patients, allow the citizens to integrate and be more involved in their well-being. And the more they're involved, the better the outcomes, and this impacts the self-care, resilience, and early intervention, improving quality of life, not just for the patients, but also their underlying communities. There is enough evidence base right now, and it continues to grow for consistent data from Europe, Asia, Australia, North America that confirm the positive outcomes, high satisfaction rates, and successful integration. And I have cases that we can discuss if the chance presents itself, of how the integration of these existing programs to current health systems in the world. In Europe, we're seeing an increased interest in integrating TCM and TCM modalities, not just from citizen groups themselves, but also from policymakers, clinicians, public health authorities. And I believe with thoughtful regulation, professional training, and robust outcome tracking, TCM can become a component of a much wider integrative health system to improve the patient's outcome and the quality of life of our citizens. It's not a either-or proposition. It's not here to replace biomedical mental health. It's here to humanize it, to enhance it, and in one very specific situation, to fill some critical gaps, in particular with areas where conventional systems often leave unaddressed, specifically dealing with chronic, long-term, stress-related, and culturally diverse presentations because of the context elements. Now, we believe at the TCMA that this integration is a beneficial necessity to really build a sustainable, inclusive, citizen-centered health system for Europe. So I want to thank you again for the opportunity to share some of the initial ideas, and continue to work with you across disciplines, across cultures, and across borders to really help us build a healthier, more balanced future for all citizens in the European Union. Thank you.
Okay, beautifully said, Aram, Dr. Kopjan. Thank you so much. Indeed, like working also on the resilience and like the self-sustainability of the patients is indeed very important. So thank you again. Yes, I would like to move forward to Dr. Davide Bertorelli. So He is a senior consultant psychiatrist trained in anthroposophic medicine. He has vast international experience in several fields of mental health in different multicultural settings. So he had worked in Italy, but also in the UK, in Australia, New Zealand, and Bolivia. He has a special interest in rehabilitation, transcultural issues, spirituality, and mental health. So we're very happy to have you here, Davida, among us, also as a conventional psychiatrist, to also give your view. So I'm actually really curious if you could fill us in how your experience is in integrating other modalities, traditional medicines into the system.
Thank you very much, Adrianne, for inviting me and being able to speak together with these other valuable colleagues and experts. It's really difficult in 5-7 minutes to give a comprehensive description of what is anthroposophic medicine. Anyway, it's a kind of a mission impossible, but I will try. I'll do my best. So anthroposophic medicine, first of all, is not an alternative medicine, but it's an integrative, complementary healing system, I would say, and is rooted in Rudolf Steiner teachings and insights. So it started more than 100 years ago. Also teachings from Dr. Ita Wegman, a Dutch physician. And is spread all over the world, I think more than 80 countries. And in order to become an anthroposophic doctor, first you need to gain a medical degree, of course, in academic medicine, and then to complete, to carry out a specific certified training in anthroposophic medicine. Rudolf Steiner anticipated that when it comes to integrating anthroposophic medicine and conventional medicine, there will be in particular two specific areas of fruitful, fertile integration in oncology and mental health. I will give you some details about the anthroposophic medicine in the field of mental health. I'm a psychiatrist, and I have a special expertise in rehab, which you know that when you speak of mental health is a broader term, which is different from psychiatry. It's interesting because WHO, World Health Organization, speaks of mental health and not of psychiatry, in the sense that psychiatry is just a part of this broader container, which is mental health. So there is no health without mental health. It's important to remember that in order to have positive outcomes in mental health, the preliminary condition is the respect of human rights. So it's important to remember this. So if human rights are not respected, it's impossible to have a good mental health. Also, we know that there are lots of stigmas, discriminations, and poverty, difficult access to mental health services remain a big barrier. I would like to highlight some special features of anthroposophic medicine, which includes also mental health fields. First, we speak of individualized care. Each patient is unique, has a different biography. For example, if you treat two patients with problems of depression, the treatment can be different. This is quite different from conventional treatment when we, in general, follow guidelines. I want to say that there are also some general guidelines also in anthroposophic medicine, but the treatment is really different and unique for each patient. Freedom of choice is another important element we have to consider, especially in the field in general in medicine, but also in mental health. So I said individualized care. So what in mental health we call a patient-centered care. Holistic perspective. So now it's quite topical and fashionable speaking of integrating physical well-being, psychological well-being and spiritual well-being. Many studies say that support the fact that spirituality and mental health are strictly connected. Many patients want to not just taking pills or psychotropic medication, which remain important, of course, but they want also what we call searching for meaning. So it's important to, and spirituality is different from religion. We have no time to differentiate this, but so many people are interested in spirituality without being part of a religion, for example. Third point, multidisciplinary approach or interdisciplinary approach. This is very peculiar of an anthroposophic medicine. Usually, not only, but anthroposophic doctors work in a primary care setting, most of them. And when you see, for example, a patient with depression or anxiety disorder, what we call the common psychiatric disorders in primary care, can be very fruitful also to involve other professional work. For example, an anthroposophically oriented psychotherapy. So there are psychotherapists who have conventional training in psychotherapy, but also a specific certified training in psychotherapy. Eurythmy therapy. Eurythmy is very something, a movement therapy, which I consider very important in my experience treating patients with mental health problems. Also art therapies, drawing, painting, sculpting, clay modeling, music therapy, speech therapy, anthroposophical rhythmical massage, also anthroposophical nursing techniques. And I don't want to forget another important ramification. So many anthroposophic doctors work in curative education and social therapy, which is focused on people with disabilities and neurodevelopmental problems.
Okay.
And to recap, I would say that definitely, the last point is anthroposophic medicine is a self-healing activation. So in this sense, it's part of the salutogenic container, in the sense that we are very knowledgeable about pathogenesis, but less knowledgeable about salutogenesis, how to promote factors that improve health. So I would say that it's a very good example of integrative medicine.
Actually, this is perfect, the thing that you're mentioning here, because this is really like also what you're saying, part of our refocusing health project, right? Like instead of focusing on the pathogen, more on really the health part and the resilience. So yes, wonderful. Thank you so much. And it's really nice to see that the anthroposophic medicine also gives such broad variety of therapies actually within also the conventional system that exists. So really nice. Thank you. Thank you so much for your contribution. Yes. Well, so this brings us actually to our last panelist of this discussion, and we are so happy to have John Sanders with us. He is actually EUHPP's executive director. So EUHPP is a patients and patients family organization. So its mission is to represent them, so people affected with severe ill mental health at a European level. So John has been the Chief Executive Officer of SHINE, and SHINE is actually an organization supporting people affected by mental ill health for over 20 years. SHINE is an Irish national non-governmental organization that works with family members and people with self-experience. So SHINE is actually the founding member, right, of EUHPP. So what he does, John oversees the day-to-day operation also in this large network, and is therefore also in very close contact with the patients and their families. So therefore, I believe he is very well placed to answer this perspective to us. So in your capacity, have you seen also the needs of the mental health patients evolve over the past decades? And also maybe to complement on that, how are these needs also currently being addressed within the conventional mental health system? So,
Adrianne, thank you for the opportunity to be here. In respect of your question, I am obviously, as you said, coming from the patient and family perspective, and I've listened very carefully to the previous speakers, and a very admirable presentations have been made, and I'm very supportive of the commentary has been made. In answer to your question, I think over time in mental health, and probably in health as well, there has been a shift in terms of how patients view their needs, their wants. Obviously, and I say it obviously, people want to get well. But in the past, people have relied on the expertise of the doctor or the system to get someone well. And they have been very much passive recipients of the care and treatment delivered by doctors and nurses and others. And I think what's happening now, and has happened for quite a number of years, is the idea that the patient has become more of a partner, has become more proactive, has become more educated in what's happening and what's available. And the relationship between the doctor and the patient has changed significantly. And I suppose there's less of a power balance and more of a contribution from the patient. And the patient is obviously involved in many of the treatments that are given. For example, lifestyle changes cannot be imposed on anybody. They must be done by the person himself. And therefore, much of what happens in terms of getting well is down to what the person or the patient does, as opposed to what the doctor tells him to do or says he should do. So I think, and that's been evidenced in the last couple of presentations there, the idea that a lot of the treatments are clinical or medical treatments which are quite narrow in many respects. One of the observations I've made from talking to people over many, many years is that patients will often say to a doctor, well, what about yoga, for example? What about acupuncture? What about some other form of intervention that's been discussed here today? And often doctors, in their defense, will say, well, I don't know, it'll do you no harm. And they may not be very encouraging of what is being suggested. And I think part of that problem is that in medical education, the student doctor does not necessarily learn firsthand about many of the complementary treatments that are available, and doesn't learn or doesn't have available or is not given the research evidence that's out there to support them. So quite naturally, a young doctor, particularly, well, any doctor might well say, I don't know, because they have not been exposed to the treatment. And that sometimes is difficult for patients to accept because they want, I suppose, the approval of their doctor to continue a particular treatment. That said, in mental health particularly, there is a huge movement towards the complementary approach. And part of that is what's been referred to earlier on in some of the presentations, the fact that traditional mental health treatment doesn't always work and doesn't work effectively. And with drugs in particular, there's huge side effects that put people off continuing drugs. Compliance of medication in mental health is a huge problem, and part of that is the unwanted side effects that people just cannot tolerate and don't wish to tolerate. And that, of course, leads to more problems. So what happens is that people often go away themselves and investigate options other than traditional psychiatric treatments. And the ones that I've been most, I suppose, familiar with and have come across both with families and with individuals is the use of acupuncture, for example, as been referenced earlier on, for anxiety and relaxation. And apparently, I've never been a subject of acupuncture, but apparently it has worked in many, many cases, and it is proven to be an effective process which does not have side effects, which is important for people. The other one that is most commonly used is mindfulness, and I respect the professor's comments about the use of the word mindfulness, but I'm using it in the context that people undertake mindfulness training, sometimes as part of a wider psychological training like cognitive behavioral therapy. Cognitive behavioral therapists in psychology often use mindfulness as a way of helping the person to ground themselves and become more focused on the issues that they have and their lifestyle generally. So mindfulness, apart from being popular and maybe trendy, has become quite common in areas of mental health, not only in anxiety and depression, as mentioned, but also in much more severe psychoses, where people do find a way of grounding themselves, if you like, and taking control. One of the words we use in mental health is the idea of recovery being about taking control of yourself and control of your life, and it's important that happens. The other point to make is that so the other therapy, if you want to use that language, that has often been used in mental health by patients is yoga. Yoga is very much in many parts of Western world a lifestyle choice.
Yes.
It's often not seen as a therapy, but it is therapeutic in the sense of what it does, and better people than me know what it does. But it does have a focus on not just the body and the training of the body, but on the mind and the relaxation of the mind and on the emotions. Excuse me, my phone is blinking away at me. And the emotions of the person as well are very much influenced and supported by yoga practices and so on. So I suppose in summary, one of the problems I've also noted is that there's very little access to the evidence that's out there for various complementary practices. Now, it may well be there, but people don't know where
They're
to go
so
looking for it.
profoundly available, but that's the thing,
Yeah.
indeed. Like
But
for
people don't know about it, and
yeah.
I think one of the dangers is that people get mixed up between the proven complementary therapies and the unproven complementary therapies. I don't know what name you want to use it, but there's a lot of therapies promoted, sometimes for profit, where there may not be necessarily a proven background or evidence base to support the use of that. And that's particularly dangerous in people with very severe mental ill health, because what you need to do for people is to provide at least an evidence-based approach, and ideally one that is effective with the minimum of side effects. I agree that these approaches should be incorporated into the general psychiatric medical approach that's out there. That's a problem, I think, because doctors by definition are trained in a model that's a very linear model. Doctors know what we mean when we talk about linear models of treatment. Sometimes these other approaches are not at one with some of the traditional approaches, but that's an issue that needs to be resolved by the profession.
But this is actually indeed a task that we have assigned ourselves to, because for our recommendations for policy recommendations for health policy, we do fully focus like on the evidence-based and also very much on that qualified practitioners will be assigned for
Newly
that.
qualified.
Mm-hmm.
And I think the last point, just to finish off, I'm probably over my time. My last point is just to make that there are some very innovative practitioners in mental health who have used systems outside of the traditional to support them. And I'm thinking of people who use mindfulness, fitness, sport, yoga, all of these practices, which in some way to complement whatever they're doing as a physician for the person and to help the person to manage their lives. And as I said originally, to achieve what they want, which is to get well, to recover, and to take control of their own lives. And that's really an important mission in mental health. So thank you for the opportunity to share whatever wisdom I may have picked up over the years, and happy to contribute to the rest of the debate. Thank you.
It's very nice to really hear the patient's perspective here, because as practitioners we already noticed that actually the question often comes from patients themselves. Like if I look in the hospital where I work, like most of the referrals from specialists actually also come from patients asking for other methods than solely the pharmaceutical approach. So yes, it's a very beautiful complementary. So maybe with this we could immediately open our Q&A, and since I have you here also on the screen, John, maybe you could also elaborate us a bit more with really real life examples where TCIH has made a meaningful contribution to patient situations. Could you maybe
there are two that I could think of. One is in yoga, where there was a person who had quite a severe psychosis, schizophrenia, and had so for about 10 years. And she was having huge problems, as I said earlier on, with maintaining the medication regime that she was prescribed, because some of the side effects she found really, really difficult. And when she got very well, she continued for a while, but then thought, well, I want to stop this because I'm now well. And she didn't understand the basic concept that you have to keep taking the medication to remain in that well state. So she wanted to get rid of the side effects. And of course, when that happened, she went into relapse within months. So spent a lot of time in her 10 years in relapses in hospitals or in clinics. And until she started to take up yoga, not so much as a therapy, but as just a pastime, a distraction in her own life, and she became deeply immersed in it. And she actually practiced to the point where she could well have gone on to teach yoga. She was quite good at it. But but one of the consequences, intended or unintended, was that she found the tolerance to the medication improved for her, and she didn't find the side effects as difficult to live with. Now, having said that, she did go back and try to get reductions and changes in medications, and they did happen. There were changes with newer medications and so on and so forth. But her very firm belief and experience is that the yoga gave her a way into controlling herself, controlling her emotions, her mind, and controlling the condition, if you like. And I have her word for it. She's alive and well, and doing very, very well. She didn't do the teaching for different reasons, but she still does the yoga. But the second person that came to mind was a person who again had a very deep psychosis, and he's actually a good friend of mine, and he spent many years with very difficult, uncontrolled psychosis, schizophrenia. And he told me that one of the things he realized is that, and I've heard this from a number of other people, he said to me one day, John, even when I was in the deepest level of psychosis, when everyone around me thought I was completely psychotic, to use that language, he said, I had a strain of real thinking. I could actually think logically and reasonably about certain things. And this convinced him that there was a thread or a window there that he could use. And he did use it. And he did spent a lot of time forcing his mind away from the irrational to the rational window that he had. And eventually, when he became much better and was able to leave hospital, he did take up mindfulness as part of a practice. And I think he did have somebody who tutored him or mentored him. I'm not sure who it was, but he still does it, and he maintains that mindfulness practice is helping him keep his focus on that window of rationality that he had, and keep blocking out, of course, the other windows of irrationality that he had. And he hasn't been in hospital for 6 or 7 years, so he's doing something right. So they're the two examples that come to me, because I know these people personally.
Yeah, thank you so much for sharing these real life examples, John Saunders. A question for Dr. Akopian. Could you maybe give me some clear examples where TCM is integrated in either like a clinical setting or a mental health public infrastructure?
Yes, thank you. I've been just warned that answers should be less than 2 minutes, so I'm going to try to condense this as quickly as I can. I have three unique, interesting applications. One deals with school districts and working with ADHD diagnosed students. In the LA Unified School District in the United States, we implemented a program, a 6-month program, specially targeting difficult ADHD young students, mostly males. And we implemented a unique TCM Qigong protocol or Tai Chi protocol called push-pull. This is a physical, moving, meditative exercise. And it was delivered to them twice a week for 6 months. Subsequent studies or subsequent analysis demonstrated a marked improvement of all participants in attendance and attention in school, which were measurement criteria for their outcomes. And it's a demonstration of how you can integrate these unique situations, and especially in school environments, younger school environments, as ADHD is really becoming a default diagnosis for many hyperactive young children, particularly boys, and that's something that could be applicable. Another case, again from the States, deals with PTSD. Now, in PTSD, especially post-Iraq, we worked with the Veterans Administration in the United States to develop a program which integrated a unique TCM acupuncture protocol in conjunction with regression therapy, which was basically a process whereby these veterans would have to reface those stressful emotions or memories and deal with or learn to minimize the physical impacts. We scheduled the acupuncture sessions immediately before and immediately after the actual regression sessions, and it showed a marked reduction in the hyperactive state and hyper tense states of the patients after the initial and subsequent emotional reaction to the regression therapy, and a downregulation of the sympathetic nervous system, so which was measured and actually produced shortening overall the cycle the number of sessions that they were required to attend. And then from a clinical perspective, we implement here in Greece, we implemented a protocol of referral networks, particularly to reduce the dependency on early medication for mild to moderate mental conditions, emotional conditions, including anxiety, including ADHD, and also stress, chronic stress, work-related stress disorders. And we found that the program is running now for about a year, and we found that the patients overall, about 70% of the patients do not have to engage with pharmaceuticals at that early, mid, mild to moderate stages. And they can, by implementing all of the integrative approaches from TCM, including acupuncture, nutritional therapy, moving exercises, Tai Chi, Qigong, etc., they were able to basically manage and mediate their emotional states and emotional well-being without dependency or without building dependency on pharmaceuticals. So there's some actual real world applications of how to integrate TCM and its modalities in both clinical and in health systems around the world.
It's really like interesting also like about the PTSD, right? We are facing a situation where people also fled from horrible situations. So they have faced traumatic incidences where the TCIH field could really have a beautiful contribution in this. Yes, thank you so much, Dr. Kopjan. Since we are a bit short of time and we have actually already heard some really, really beautiful examples also of a professor, the both professors actually, psychiatrists. I would actually like to give the word still to our partner from Charité, Hiba, after which we might have a chance to still watch the video of our MEP. So I will check base with the technical support and give the word to Hiba.
Thank you so much, Adrianne. Thank you, everyone, for a beautiful, beautiful conversation. I think I love that our webinar just kept on, every intervention kept on building off the previous one, and I heard a lot of great alignment. So really what I would say is just a summary of everything that everyone has contributed already in terms of best practices and how do we move forward. It goes without saying that we are facing a crisis that requires a lot of tools, a lot of creativity and innovation in terms of tackling mental health issues. And today's webinar reinforces a shared message that addressing mental health crisis requires not only medical interventions, but also community-based, inclusive, accessible, and preventive strategies. These must recognize the interconnectedness of mental, physical, and environmental health in line with the One Health perspective and approach. And therefore, to move forward, we need greater collaboration between the different sectors, the policymakers, the researchers, the practitioners, the communities, the individuals. And that's why I really love the composition of our panel today, because it does represent all these perspectives. So investing in regulation, research and innovation, including TCIH, traditional complementary integrative healthcare, is not optional. It's really essential nowadays. Therefore, we should continue building on the momentum that we have to amplify good practices that are rooted in science. And we did discuss this quite a bit today, as well as the beautiful experiences that our professors have in the clinical settings, and keep mental health at the center of our policy agendas. I loved the mention of human rights, and if human rights are not preserved, then we cannot really speak about mental health. And I loved also the comment around community and the importance of having friends and family who we are connected with, and the importance of preventing loneliness and isolation to preserve our mental health and promote our well-being. So with these things, I hope that we can find some time for the video and not keep everyone after time. I'm very, very grateful from the Charité Competence Center for for Traditional and Integrative Medicine. We are very grateful for our collaboration with EUROCAM, and very grateful for everyone on this panel. And with that, I turn the word back to Adrianne. Thank you all.
Okay, thank you so much, Hiba. I've just checked base, and we have the opportunity now to finally watch the video, after which we will have still some concluding words. So stay tuned for that. So please let's have the video on.
Hello everyone, and first of all, let me thank for the opportunity to participate in this important webinar dedicated to mental health care, and especially addressing traditional, complementary, and integrative healthcare. Why we talk about mental health, I think it's now understandable to the most of the society, because this becomes a bigger and bigger problem. And we can mention today the post-COVID period that is very much associated with increase of the society, depressions, and other mental health problems. But also we can speak about other challenges that are increasing very much the level of the stress. And if this is continuing, so later on it can become a serious mental health problem. We see the anxiety because of the geopolitical challenges, because of the war happening in Europe. And we are seeing now more and more children being born with a specific mental conditions. And I'm talking about autism spectrum disorders and other problems that is becoming a bigger and bigger challenge, not just for society and parents, but also for the healthcare professionals. So I think it's a very, very important that we would talk and see all the possible opportunities how to address those challenges these days. And this is not the secret that now the health systems are facing problems with resources, and mental health is not an exemption. And there are therapies that can contribute significantly to the solution of the problems. And I know that it's not easy to have a discussion about traditional and complementary medicine, because there is a skepticism sometimes between politicians, healthcare professionals. But today, nobody is already surprised when we prescribe, for example, antidepressants that are produced from the herbs, like Hypericum perforatum. We know that it's evidence-based. We know that it's clinically proven. At the same time, we have therapies that are not treating, let's say, conditions, but help patients to survive or adjust to the conditions they have. And I'm talking about kinetherapy, hippotherapy, apitherapy, and many other therapies that are not traditionally common and usually are not taught during the regular or traditional medical studies. But it doesn't mean that they are not effective. And we have to be open-minded to these therapies and understand that they can be also a very important while contributing to the patient's health and to the adjustment to the conditions they do have during their life. And to mention, while mentioning that, at the same time, we have to be sure that they are safe, they are effective, that persons who are using these therapies are recognized professionals, they are licensed or certified in a proper way. And being a Minister of Health in my own country, I had an experience while introducing a legislation to regulate those therapies, to legalize those therapies, to set up the standards how the professionals can be trained later on to use these different kind of therapies. So thank you very much for organizing this webinar. I think it's a very, very important these days to talk about alternatives, to talk about possibilities. And I'm pretty sure you will have a very fruitful, informative discussion that will later on contribute to the European-wide development of the opportunities to position these therapies in the healthcare sector. And I hope this discussion will also contribute to the development of a position paper and will contribute to advocacy in the European level while talking about traditional, complementary, and integrative healthcare. So thank you once again for the invitation, and I wish you a good and fruitful webinar to all of you. Thank you.
Well, I'm really happy that we managed to have this video on, because it was a really inspiring contribution. And something that I would also like to mention is that we actually received a lot of support also from other MEPs on this. So yes, we could definitely move forward on this part. So actually, we're almost at the end of the webinar, but before I will leave you, I will also give the floor to Susan, but first let me mention one important thing. So as you have heard concerning the One Health principle, we have this refocusing health project. So for this, we have a beautiful newsletter that comes out quarterly. So this will, like a link will be posted in the chats where you can subscribe to stay up to date on all the developments all around Europe, because I've seen a lot of really nice questions coming up. So you can definitely find also more information on our website. So yes, so everyone, the health policy platform again, but also all our distinguished speakers, I'm really happy to have this like broad overview from all these different perspectives. I'm very grateful for that. Okay, so let me shortly give an introduction to Susan Schunde-Tatzba. She's a medical doctor who got her introduction to complementary medicine in China, where she had spent actually an academic term in 1988. She specialized in occupational health and works in Vienna. She's a chairperson of ECPM, which is the European Council of Doctors of Plurality in Medicine. And it's also one of the founding members, actually, of EUROCAM and one of the initiators of Cambrella, the EU project on complementary medicine in the EU Frame Project 7. So she's actually now also the coordinator of the working group of the mental health of EUROCAM. So let me give you the floor for the concluding words. Susan, please.
Hello and good afternoon. Thank you, Adrianne. And it's really a pleasure for me to try to summarize what had happened today. I really want to thank everybody who worked on the preparatory activity to get this seminar available, making it possible. And I really especially want to thank all our speakers to give their experience in their special field. We all heard that mental illness is a global issue in the 21st century, especially after the COVID crisis. We know there is scientific evidence that especially young people are extremely exposed, and it really needs that we work all together with all the different modalities. And we hear today a very broad overview of good examples on how complementary and integrative techniques from different backgrounds, from different countries, from different traditions work really fine. We really, especially as well as a doctor for occupational health, I'm really very keen in the prevention. And we heard today from a lot of these speakers that we can use many of these techniques like yoga or meditation. And so that not only for treating people who are already suffering from mental health issues, but as well as a long-term preventive aspect to keep healthy, to keep our mind and body healthy. I really appreciated the ideas that we had to heard this mental health as a part of the mind and body idea, but not only at the mind and body, but as well in the field of the integrated health approach as One Health for All, that we have to see in our treatment approaches, that we have here background from different cultural medical parts, but as well from what is now the mainstream medical approach. We heard a lot that we have reached amount of studies now where we have evidence-based medicine background, and there are studies in many countries from all over the world had done. And what I'm really be grateful that we also heard some requests that one aspect we fight for long since EUROCAM has been founded, that we have to have well-trained, certified professionals who teach the people on acupuncture, who teach the people on yoga and Tai Chi and whatever, but that we also have in the medical schools or in the nursing schools or other medical training facilities to give those people who in the future will treat patients, care for patients, that they have an idea on what complementary medicine could offer for this, even if they don't want to be trained as a specialist in one of these techniques. So the request that everybody can take control of his own life, I think, is an important request. We heard from the representative for the Patients Initiative, and we saw that our techniques could support people to stay healthy and also to be that these techniques be a part to integrate in an overall treatment plan. Certainly, we need to go on. It was already mentioned that we will work now on a position paper to integrate more traditional aspects in the mental health. And I really want to call all who want to contribute to this aspect to come forward. You already heard that we have regular newsletters, and you will find more on our webpage of EUROCAM. So I think we really have to build momentum. We have to collaborate. And I think our techniques have a lot to offer for the overall mental health and integrative health. It's not only about mental health, but as well as physical health, social health. And I'm really looking forward for the next development. And please stay tuned for our next events. And you will find the information at our website. And I want to thank again to all who stayed till now to listen to it. And I really wish everybody a very nice afternoon. And hopefully you have time to go out to the nature. There is a lot of research, but nature is as well a very good aspect to help you to take control of your own life. Have a nice, good afternoon. All the best here from Vienna, and from all our participants and all our colleagues who contributed. Bye, and all the best. Till the next time.